Choosing the muscles to place the needles, we palpate up at the top of the glutes. We have glute med and that portion here, and then glute max here. Typically you'll find a trigger point right up at the top of that muscle belly near the ilial rim. So we find a trigger point by strumming across the top of the glute, and then placement of the needle. First one would be glute max. The second one is going to be glute min and glute medius. Then the four muscles along the hip, you got the deep hip rotators, and then the insertion of gluteus medius and minimus at the top of the trochanter. And the glute max near the superior edge of the trochanter. So in finding these muscles, we come along the trochanter, just right on the inside of the trochanter, running fingers medial to lateral, finding those trigger points, bracketing the trochanter, placing the needle right on top, and then going all the way down to the bone. So this will be covering the deep hip rotators.
And the length of these needles are 75s?
They're 75 millimeter needles, correct. All the way down to the bone. And then the superior border of the trochanter, where glute med and min attach, it's going to come on top of the trochanter. Insert a needle right on top of that musculotendinous junction. After the needles are placed, we will pull them out slightly just to be able to attach the alligator clips to the needles. Okay, once we put the needles in the placement, we attach the alligator clips with the electrical stimulation. The settings we use were 2 hertz, 150 microseconds at 10 minutes. We turn up each channel slowly until we see some tetany and to the patient's comfort level. So we don't want that much contraction, just a little bit of contraction like that. A little too much, so we probably backed it off a little bit. Okay, so once we have a slight contraction, then we leave it in. We monitor the patient as we're doing the electrical stimulation for the dry needling. And that is a setup for the electrical dry needling for the hip in this case study.